Hi, I'm Erica Smith, Surgical Solutions Manager at Schein Medical, and welcome to Coastal Virginia Surgery Center. We are about to take a tour of one of our customers' facilities. Come on in.
This is our reception area. Our patients and their family member come up and are admitted here at our desk. Over here is our doctor's consultation room. We'll put the family in here. Doctor comes in after surgery and gives them a report. These doors are locked at all times. We have them open for you. This is our lounge, which is very nice because it has windows and our staff and doctors can enjoy quick breaks between surgery. This is my office. This is our scheduler's office. And we're going toward the pre-op area where a patient comes, is weighed, and talks to Amy. You're the best person to describe what happens because you're here every day.
What we do is when the patients come in, we bring them back, we weigh them. We bring them back into the bay, instruct them to get in a gown, and get them hooked up to the monitor, take their blood pressure, and then we let anesthesia know and the doctor know that they are here.
And the nurse that's going to be in the room will all talk to the patient, introduce themselves so that the patient has a sense of comfort who they're going to be with that day. Then we give them a light sedative and wheel them into the OR. The nice thing about this particular center is that we're on the 3rd floor so we can have windows. And as you see, it's light and bright, and as the patient is being wheeled back, they have a really nice feel, very calm area.
It's a beautiful view.
It is. I'm going to take you into this particular OR. We have it set up for major surgery for spine case. We have anesthesia. We decided to use the Steris boom system so that we don't have a lot of cords on the floor. And as you can probably tell, this is going to be one of the biggest OR rooms you've ever seen.
Yeah, it's huge.
It is huge. So that we can get C-arms in here, etc. This is our inner core where we have all of our instruments, trays, etc. ready to go, sterilized. It has to be kept at a certain temperature. If anything happens, like it falls below it, all this would have to be redone. So we are very, very careful, have a very good system that we haven't ever had to do that. But a lot of work goes into having it look like it does. Our vendors really like it because we have it so well organized.
And look at these beautiful Schein gowns right here. They're amazing.
We are going to go over into where our anesthesia room is. It's of course always locked. Here is our biohazard trash area. We have a variety of things we have to be careful about. So everything that has to be disposed of appropriately goes into red bag. Those 2 items are called Neptunes. They are used during surgery. It makes it very easy as the doctor is suctioning off fluids to dispose of them. This is where we keep our medical supplies. This is Shannon and Teresa. And as you see, it's very neat and very well organized and very Schein.
That's how I like it.
This is our electrical room. It's the biggest electrical room you'll ever see. If anything happens, we know where to go. It's bigger than my office. And this is the decon area, our Steris system. These are our tubs. Washers are over here. We have certain items that we can't put through the washer. We have to clean and pass through here to use the V-Pro. So we have a little slide in here so that they can appropriately put it so it doesn't contaminate anything else.
This is an amazing decon room. I love all things infection prevention and SPD, and this is it.
Yes.
This is it.
We've had people from the hospital come in and say the hospital's SPD isn't as elegant as this is.
This is amazing, absolutely amazing.
We're very proud of it, and as you can see, April and Aubrey keep it very neat and very clean.
Very clean.
And this is our clean room. And this is Aubrey.
My name is Aubrey, and this is our sterile processing department where we inspect and sterilize all the instruments. The process will be as soon as everything clean and come out of the washer, so we took them out, and then we just gonna put where they belong. And then we normally inspect them, for cleanliness and make sure that they work properly, okay? We use this to make sure that the temperature has met for ambient temperature, which is 72 to 80 degrees. So that means that should be ready to transfer to the OR core.
After surgery, the patient is wheeled out this way and goes into PACU, which means recovery room. This is our recovery area. Over here is our isolation room, and we use that for patients who are first responders, need quiet, need something more relaxed. And so this is the recovery. We have one in the pre-op just for our special patients. Here are about 6 bays where we can recover patients. Usually use about 4 in any given day. This is our PACU nurse who has just joined us, and so we're very happy to have her. When we recovered the patient, and they are ready to be discharged, we bring them over here. They're seated here. We bring the family so we can give them the discharge instructions, at which point they're ready to leave. We put them in their wheelchair. So they're discharged, and our nurses go back and get the next patient. I'm going to take you this way, and you can see it makes a complete circle. And you're back where you started.
Barbara, thank you so much for taking us on a tour of this beautiful, beautiful facility. And thank you guys for watching on this tour at Coastal Virginia Surgery Center. Again, my name is Erica Smith. We'll see you next time.